पहला सवाल आपके लिए टाइम चालू होता है अब ऑप्शंस नहीं रहेंगे
सर हम आपके बड़े फैन
You became a doctor by choice or by chance? If you became by choice, why?
I became a doctor by choice because I was brought up in a family. Both my parents were doctors, and they didn't force me. They said, "You do whatever you want." I had grown up in that atmosphere, and it was obviously by choice that I became a doctor. I became an ENT surgeon by chance.
That was my second question. Being the master, you stole my second question. So ENT surgeon you became by chance.
Yeah.
Can you describe it?
No, because I had decided that my father was a general practitioner, and I had said I was never one of those very bright students. That was her. She was always much better, is much better than me. I said I'll do my MBBS and I'll take over my father's general practice. I don't know, something went wrong and I got more marks in surgery. And all my friends were doing something. Somebody was doing general surgery, somebody wanted to do orthopedics. So I said I'll also do surgery. I didn't want to do general surgery. Orthopedics, too many emergencies. Cardiac, plastic 5 years, neuro 5 years. That left ENT and I one organ, ENT at least 3. ENT. I'm not exaggerating, that's how I entered ENT. Okay?
Again, point here. Practice makes man perfect. After years of marriage, I've seen most of the seasoned smart husbands publicly acclaim that their wives were smarter in college, in school, in everything.
No, there is a standard joke between us. I say, you're smarter than I am because you married me and I married you.
Did you ever think of becoming a famous doctor or popular doctor? Or is it that you just decide to be a good doctor and the rest of it happened as a byproduct?
No, that's what it is. I never was ambitious. Where do you see yourself 5 years from now or 10 years from now? You just do what comes naturally to you and do it to the best of your ability. I mean, that was the only thing I followed. I don't think I ever made plans that I want to be this, I want to be that.
I think Sir made a fantastic point, because I have seen many people talking that 5 years from now I will be doing this. I think Sanjay and we met a person who went on a diet program and he said, when I meet you on August 16th, my weight will be this much. And it was nowhere that at the end of the day. See, the most certain thing about life is the uncertainty. When we don't know whether today night in this Goa hotel, how many of us going to go to sleep and get up tomorrow morning. There's no point in talking 5 years from now I will be this. Isn't it? Even the most seasoned people who said, Ab ki baar 400 par. So, sir, you are a fantastic surgeon, the whole world knows about it. But you are one of the surgeons who started your life with vertigo. And I remember you telling me that thing where you were given a thesis where you have to put that lead, melt it and put it into the labyrinth, break the bones and take out the models. What made you go into vertigo? Was it providence again? Or?
I was a houseman, I just joined the department. And Dr. Deepak, by the way, before I start talking about this, let me tell you that I think we were fortunate. I was fortunate that we were blessed with the most amazing teachers that I got. Dr. Joe Disa, Dr. S.R. Rege, Dr. Kandik, Dr. K.L. Shah. And Dr. Joe Disa was always at the forefront of ENT. Anything new, he would go abroad for a conference, would come back with that, and he wanted to have it in his department. So when I just joined ENT, he came back with a small single-channel ENG machine. And he said, you will do electrodistymography, and I looked at him blankly. And he said, you will write your thesis on this, otherwise I'll see to it that you never get your license. That was the standard threat for anything that they wanted it, then you do it or, So, and there was nobody doing it at that time. I had to sort of hunt for books. There were hardly any books on electrodistymography. I had to hunt for books and read up and start working on it. And I started working on it, got interested, started reading up about it. And the others were so happy that they could dump their vertigo cases onto me. And after the OPD was over, they would all go for lunch and I would be sitting there doing electrodistymography. But it's a subject that many of us, when we study for MBBS, put it as option and pray that nobody will ask me a question on the vestibular system. And here I was forced to do it. I worked in it for some time, and then 1975, Professor Klaus Clausen came to India. I met him. And I worked with him on a book where the co-authors were Dr. Joe Disa and Professor Clausen, but most of the writing was done by me with Professor Clausen. And then he said, why don't you come to Germany? So that's how I got pulled into vertigo. And I'm not sorry about that, because I think one of the most amazing personalities that I ever met who had a terrific impact on my life is Professor Clausen. I mean, what I learned from him changed my life. So that's how I got pulled into vertigo. And it became a passion. I started a vertigo clinic at KEM and we built up a database of almost close to 10,000 patients. KEM was like a factory. And in all this, my other teachers were very encouraging. So that's how I got into vertigo.
Two things I can remember. Sir, at one point, like all achievers, faced a lot of hostility, obviously jealousy. He was pretty disturbed. And Clausen told him, because it's something he has told me, and we had a private conversation long back, and I remember these things. He said Clausen told him, one of the ways of gauging your popularity...
No, sir, let me put it to you exactly how he said. Yes. He said, Milind, height is measured in centimeters. Weight is measured in kilograms. And your success in the medical field by the number of people who are jealous of you.
So I remember it right, but I am not Kirtane, so I can't get those words. The second thing, so much of parallels. He was saddled with his ENG machine. I think it was the second Alchem conclave or the first Alchem conclave. We were supposed to talk in 3 places. I was very happy that Kirtane sir had selected me. And I had finished about 12 years of my surgical career. And suddenly I see the topic he has given me. Biofilms. So I called sir, told him, sir, thank you for giving me this opportunity. But sir, what is this biofilm? He said, that precisely is why I want new people to know about it. You better get prepared and talk about it. Today, this skull-base osteomyelitis, which I treat the maximum in my hospital, and a huge part of my practice, is thanks to that biofilm lecture that I had to prepare for what sir gave me. Sir, the next question. I've been closely watching you You have really mixed and matched your practice very well. Means you have had this KM, which gives you your academics and things to work, teach, mentor. You also practice in Kambalail Hospital, Saifi Hospital, which caters to middle class or middle class. And you also practice in Hinduja, Rich Candy, which caters to the financially better society. Again, these things happen by providence. And one great thing about you is you stuck with KM till you became the professor emeritus. And the other tremendous thing you did was you set up that cadaver lab, I remember, with whatever funding you could save, and got 2 brand new Stores cameras at that time.
So,
can you elaborate a little on that?
Yeah, I think whatever I am today, I think I owe a lot to KEM. It's been a fabulous place, and as I said, whether it was undergraduate or postgraduate, we were really blessed with teachers who encourage you. You know, Deepak, I'll tell you one thing. In my postgraduate career, 3 years that you take to do your MSc MT, I mean, we respected our teachers very much, but the beauties we were not afraid of. There was no fear. I mean, sometimes you got a firing if you did something wrong, yes, but you knew that in spite of that, they would encourage you. I mean, this is something which I say to all teachers of today, that if you're a teacher, you can't expect a student to learn in an atmosphere of fear. It has to be open, and respect is commanded, it's not demanded. So, I mean, we respected our teachers tremendously, but we could talk to them, we could discuss with them, we could express our views, even if they were contrary to what they were teaching. So I think that way, for me, KEM has been something which is a part of my life. In spite of being a Bombay student, I stayed there in the hostel in MBBS days. And I spent more of my awake time, as my daughter put it to me, more of my awake time in KEM than at home. I think what I did for KEM was something that I would do for my own house. And regarding handling patients, whether they were KEM patients or they were Bollywood biggies were coming to Hinduja or whatever it is, I think a patient is a patient, and you give that patient the best attention you can. I think that's a simple thing that you follow, and I think it's something that all of us need to do. When that person sits in front of you, he's asking you for your help. And as a matter of fact, we had a teacher with whom I then became very close, Dr. Manubai Kothari, who said that, as a matter of fact, we should thank the patient that you're giving me an opportunity to help you. That's the attitude that with which we go. So whether it's a patient who's super rich or is a KEM patient, the amount of attention you would give to that patient would be the same.
I think again I will quote sir. I asked him once, sir, you have told me that you never get angry on a patient. He gets angry on the patient's attendant sometimes, shouts at them or whatever, raises his voice. Never with the patient. Because he said, a good carpenter...
A bad carpenter.
Okay. A bad carpenter also never complains. No, you have rephrased me. I said a good carpenter doesn't complain about the wood. Only a bad carpenter...
No. You got it all wrong.
Oh, fine. Fair enough. You are the teacher. रिश्ते में तो आप हमारे बाप हो.
The actual saying in English is a bad carpenter blames his tools, but he doesn't blame the wood. So for us, the wood is that patient.
Absolutely.
Now, he may come to you with some absolutely crazy complaints, but if he's coming there, taking his time out, sitting in front of you, it's obviously because in his mind he thinks he's suffering. So, but I'll also tell you one thing. I learned very quickly that you must take your patient seriously, whatever he says. I had a 25-year-old patient who came one day to me at KM OPD. He sat in front of me and I said, "Bhaiya, aapko kya hota hai?" I said, "Dekho sir, सांस लेता हूँ ना यहाँ ठंडा लगता है." बोले क्या होता है? बोले देखो सर, सांस लेता हूँ यहाँ ठंडा लगता है. I examined him, ENT completely normal. So I said I must refer him to psychiatry. And just to convince him that there was nothing wrong with him. That time there was no CT scan, nothing. I said X-ray करके आओ. He did an X-ray skull lateral view and came. He had pneumocephalus. He had a fractured cribriform plate, and every breath that he took. So then I realized that if a patient tells you something, don't laugh at him, take it seriously. Maybe ultimately it turns out to be totally psychogenic. But give him the benefit of that.
And one,
you said about not raising voice. They don't want me to say that.
Yeah, take this.
Seekho.
Sorry to contradict you. You're talking about his not raising his voice except at the attendant. Funny thing is, he gets overwhelmed. A lot of patients and relatives get to his brains. I asked his assistant, Dr. Dhruv Satavadekar, I asked him, have you seen him getting angry anytime? He said, all of us get irritated with the patients and the relatives. We know that sir is angry only when he just stands up. When he's sitting down, he just stands up, then we know that he's now angry. He's never raised his voice, not even at home, never anywhere. And on his 75th birthday, I had gone to Saifi Hospital. He had said, please get something for the nursing staff and everybody. And they gave him a gold Ganpati, nurses and ward boys, they contributed. And I asked the theatre sister, I said, Jessie, are you crazy? Why do you have to spend so much money? She started crying. She said, he's the only surgeon who gives us respect. No shouting, no throwing instruments. Like any other surgeon, he must be getting bad instruments at times and it is frustrating, but he doesn't lose his temper, so he doesn't shout anytime.
in fact, I had asked him this question. Sir, you're not a thrower guy as they say in cricket, where people keep throwing instruments, throwing tantrums. He said, as a surgeon, you're the captain of the ship. The anesthetist, everybody is looking at you. And if you are shouting, it means you are not in control of the situation in the case. This is what he had told me. And one good point he made, good teachers, good mentors, they do admonish us when we do something wrong. But there's a good dose of affection in that voice. When we are young and we did something wrong, fathers, brothers, they will talk to you in a very rough way. But you see the mothers or the grandparents, they will fire you, but there's a dose of affection. And Mahatma Gandhi had said, any piece of advice, unless it is laced with a bit of affection, will not reach the place it has to reach. I think Sir made a very good point that they were not scared of their teachers. Sir, a lot of us do practice, a lot of us are ethical, a lot of us have been successful. But not all of us teach, or teach with a passion, or teach as if it's a mission. And all these people will agree This is one trait we have seen in you. Again, to quote you, his one-liners are simply fantastic. They stay in your brain. He said, when he makes an important point, he does raise his voice better. When you teach, you learn. That's what he told me. So please.
It's very simple. If you want to teach, you want to have the correct information. I mean, every time I would present a paper or give a lecture, I would go and prepare. I had to be sure that I had the latest information in the correct order. So if you're going to teach, as a matter of fact, I tell my students that the best way for you to learn is you read a topic, get hold of your co-residents and say, I'm going to teach you. Because you'll come to a point where there's a certain aspect of that subject which you will not be able to tell them, and you realize this is the part which I have not understood properly, let me just go. Otherwise, when we do revisions, you start again with page 1 and go through the whole thing, instead of which, when you teach, you understand which part you're not clear about. Just go and update yourself on it. So, when you teach people, you understand how much you have understood versus words better.
But still, I find a tremendous element of passion and a mission. It's not just that you will know more things. I don't think it is just that.
The love of teaching. I mean, I was at KEM as a teacher. So, and we had teachers who did the same. I mean, I remember Dr. Karnik would finish his practice and then at 9 o'clock at night, come to the department to take clinics. So we were brought up in that atmosphere. I mean, I told you about encouragement from teachers. I think I'll just relate this one incident. I was forced into vertigo. So all vertigo cases landed up with me. And at that time, one big thing was translabyrinthine cochleovestibular neurectomy for intractable Meniere's disease. And I used to run a vertigo clinic. I got such a patient. And no relief, drop attack. So, and that time this gentamicin intratympanic was not there. So I told Dr. Karnik, I said, sir, this is a patient and you should take him up for translabyrinthine cochleovestibular neurectomy. I knew that he had been to House Here Institute, he had seen the operation. I had never seen it myself. But I used to practice on cadaver temporal bones. So he says, are you crazy? I mean, are you sure what you're talking about? And yes, sir, I gave him all the facts. He says, okay, keep it on the list tomorrow. Next day, I prepared the theatre properly, got the patient anesthetized, scrubbed, ready, everything fine. And Dr. Karnik walked in and I said, sir, patient is ready. And he said, okay, you start. I said, I start? He said, yes, you start. You have done it on cadavers? I said, yes. And if you can believe this, that my chief sat at the head end, putting water with that rubber balloon, while I did a translabyrinthine cochleovestibular neurectomy, and I'm talking about the 1970s. Yeah? And when I showed him the interauditory meatus, I opened the dura and said, sir, that's the facial nerve, cochlear nerve. I sectioned it. I showed the vestibular nerves, sectioned them. He just got up and said, okay, very good. But he sat there for 3 hours putting water while I, as his junior, I was his undergraduate student, his postgraduate student, was doing that operation for the first time in the department. Now, that is the kind of encouragement that we got. You mentioned something else about my pouring hot lead into temporal bones, and I'll tell you what that story is. There was a professor of anatomy with whom I used to play badminton every morning. And he, for some reason, wanted a thesis written. And he says, I want some anatomy things, but it should be original work. Now at that time, again, we didn't have CT scans. So we used to do transorbital X-rays to measure the diameters of the interauditory meatus. There was a lot of article on the variation on the two sides, etc. So I started getting temporal bones from those cadavers which were unclaimed bodies, thing. And that attendant would remove 2 temporal bones and bring them to me. And I want to make all of you very jealous. Sometimes he would get me 4 bones. And I would pay him 1 rupee.
1 rupee.
And I would sit there from the intra-aortic meatus, take out all the nerves. Then I would pour molten, this soldering iron that you have. Pour it into that so it would solidify. Break open the bone and then with vernier calipers take measurements at the inner end, middle and outer end of the intra-aortic canal and documented the variations on the 2 sides for this person in the department of anatomy with no expectations on my side at all. This is what I have done. And Dr. Karnik once again, Kirtane, why don't you give that for Cooper Award? I said, sir, what Cooper Award? The previous person who had got the Cooper Award was Dr. P. Ghosh, who had described some new operation for velopharyngeal insufficiency. I said, that work can... He said, give it, no? And I gave that. And I got the Cooper Award, 1977 I think it was. And that again was a complete sort of changing point in my life, because I stood there on the dais with very senior ENT surgeons who seriously listened to what I had to say, came and complimented me, and that gave me that boost in confidence that yes, it's good work that gets appreciated. So for me, I think that was one absolute changing point. So that and meeting Professor Clauser in 75, these 2 things I think were really the encouragement that I required to say, do more.
And
so the point here is any work that you're forced to do, as long as you do it with sincerity, will never go waste in your life. Whether it's that ENG machine which was forced upon me, or whether it was this work that I did with no expectations, but as long as you do.
I totally agree with sir. During my own life, when I went to the Director of Medical Education, the clerk told me, the only clinical PG seat you can get with your marks is ENT. Otherwise, I can give you microbiology, pathology, blah, blah, whatever. ENT was the only seat I could have got. So I decided anyway I have to do this. Better smile and do it rather than keep crying. So I think...
Deepak, if you allow me, just one more thing I wanted to say here. Dr. Disa, I told you about.
Yes.
He came back once, he'd been to Belgium to Jean Marquet. And Jean Marquet was doing total tympano-ossicular homographs.
Okay.
So, usual threat. Kirtane, by the end of the month, I want 40 grants. Otherwise? Okay, sir. So I would sit there, again that same boy would get me fresh temporal bones, and then I would have to dissect tympanomeatal flap all around, take out the tympanic membrane with the malleus incus stapes intact. And it wasn't easy because sometimes the incus stapedial joint would go or something would happen. So I was just sitting every evening doing multiple bones. And I remember the first stapes that I was given to do. I think Dr. Karnik was standing behind him, and he said, you start, and when you get stuck, I will join and take over. I said, okay, sir, elevate the flap, tympanomeatal flap. I said, in 3 minutes I had elevated it. He said, okay, cut the stapedial cut, remove the stapes, remove. He said, Kirtane, are you sure this is the first staple you're doing? I said, sir, the number of tympano-ossicular homo, again there, it was something that was forced upon me. But it gave me a tremendous confidence. So any work that you do in the subject, you may think at that time that it's a waste of time, but somewhere in your life, it will come in useful.
I think those PG exam threats were that time like the enforcement directorate. One more great thing that I saw in you once, only once I sat for about 15 minutes in an OPD and a patient came. Somebody had tried a pinaplasty long back and actually instead of plastic there is a hole somewhere. But whatever it is, what I saw in your OPD, you may have your own personal opinion about any surgeon and the way he or she practices, but you never badmouth a colleague in practice in front of the patient.
Again, Dr. Karnik, we're sitting in the OPD, this patient comes with a huge septal perforation and a depressed ridge of nose, and he's complaining against the previous surgeon. And Dr. Karnik said to him, Hota hai. If you open the books, you know these are complications written. Don't worry, we will set it right for you.
But you went one step further. I saw you telling, actually the other surgeon has done a good job. This is what you said.
He turned around to me and said, never criticize a colleague in front of the patient. You can pick up the phone and dial up with the colleague afterwards and fire him. But don't say it in front of the patient, because if it's his turn today, it may be your turn tomorrow. And I think Dr. Sanjay Agarwal will bear witness to this. That
incident I remember.
You can share that if you are in the end. But you have to come back.
But I think that was your last question, so now everybody's...
No, still the drink has been given to all of them. They can't complain. This is my day, and I told you I'm X-ray PNS.
Sanjay, you want to?
Yeah, I'm
No names.
No names. One of the fortunate student, we used to come to Indore, and my direct teaching was with him. I used to assist him, and then we used to hold OPD first. So one day in the operation theatre, a patient came with a CT scan and telling the problem. When I saw the CT scan, even uncinectomy was not done. And there is
been told ke fest kiya hua.
yeah, and the surgeon told the face was done and this. Sir told, good job done. So I asked him, sir, even in scan, so that is his greatness. I saw personally.
Now, what we told the patient is, और थोड़ा करना पड़ेगा फिर कर देंगे. But this is something that was inculcated into us by our teacher. So that's how.
And sir, you are attired on a regular working day most of the days. You could have worn much more fancier dresses, coats and all this. But we have always seen you with a half shirt, mostly white, and even your spectacle frame. I don't see whether you color your hair at all. Is it just that this is what you are and you would like to be like that?
I'm comfortable with what I wear, so that's it.
Don't give much importance. Sir, I also know for sure that on stage you appear amazing when you talk. But whenever you make your presentations, you rehearse quite a lot. Is that true?
Absolutely. I will go over it because you have to get into the mind of the audience for them to understand what you're trying to say. So you have to tailor it, tune it down so that it becomes presentable.
There is one information leaked by Naveen Krishnamurthy. You did a technology transfer by sending it to me and he's still with me actually. So
yeah, sometimes my students and my residents hate me for it because I make them change it and do it again, and I use them as sounding boards.
What is work-life balance for you?
Yeah, I think right now is not the right time to talk about it. But as I said, she managed the whole house. If I were to live my life all over again, I would do the same, but I think I would carve out more time for the family, which
That was actually my last question. But two more things, sir. What makes you go? At 80, we find you a tremendous inspiration. You are one of the fittest 80-year-olds that I've seen, or 80 years young, whichever way you call it. Your energy, your clarity, your memory. What drives you?
I've got nothing else to do. No, I love my work.
Probably you also respect and love life. You respect and love life, probably.
Yeah, I mean, no, as I said, I really like the work that I do. Sometimes it gets a bit of a strain, especially when you meet some patients who can really try your patience.
Yeah, so somebody wanted to ask it, they will ask you later.
Yeah.
How you manage your BBIP patients who can get pain in the dash, whatever, so.
Like you mean?
Yeah, no,
No, I think I enjoy what I do, so I just keep on doing it.
And I've seen one more thing. Generally, as we age, the common behavior is that we say, oh, the younger generation, this, that, I don't see it. But you have always told on the stage good things about the younger generation.
That's the truth today. I mean, if you see the quality of work that's being done by the younger generation, many of them are far better today than what I was when I was their age. Let's face it. So, it may be because of access to information, access to equipment, whatever it is, but today we've got in every field of ENT people in the country today who are on international stage at a very young age, and I think that is just fantastic. It's the truth. There's no question about it. And about getting old, as you said, there's a cousin of mine who gave me this dictum which is stood with me. It says, never complain about getting old, because the alternative is not great.
Sir, teaching, learning, being a very good doctor, a popular one, and a very good person at home in the sense, Madam herself said you never raised your voice. Because I have sit in that same seat of thorns. What made you think of becoming or contesting for the AOI president? Because that's a political post as well as academic.
It was again being in KEM. Dr. Disa, Secretary, President. Dr. S.R. Rege, Treasurer, Secretary, President. Dr. Karanik, Secretary, President. Dr. K.L. Shah, Treasurer, Secretary, President. So it was like the in thing to do. And I just went with the flow. Because what had happened was, I was doing the correspondence for all these people. And that's how I got to know a lot of ENTs at a very personal level because I interacted with them. So that became a way of life. AOI also became a way of life with me because I was busy organizing the scientific programs, meeting so many people. Just went with the flow.
Last two questions. Any regrets?
Yeah, like I told you, if I were to do it all over again, the same thing, but more time for the family. So that's one regret. Yeah, that's about
2,038 ENT postgraduates coming out every year. What would be your advice to the new postgraduates now who are coming out?
when you said 2038, I was wondering whether you were asking me about what I'll be doing in 2038.
There is a good possibility. Why? You will be only 92. So there's no question. I think that's a done deal. And our Prime Minister is talking of 2047. What are we worrying about 2030? Yeah. So I think, what is your advice? Because now so many doctors coming out and so much of competition. Personally, I believe competition was always there.
It was always there, and I think just have the confidence in yourself. But I think where I lacked, what I lacked was, except for those 6 months that I spent with Professor Clausen, I have had no formal training. say for example in the subspecialization like endoscopic sinus surgery or cochlear implants, it was all a self-learning process. I had no teachers to teach me cochlear implants, I had no teachers to teach me sinus surgery. There was nothing available, no books, nothing. Cochlear implants books were available, but for endoscopic sinus surgery there was hardly anything till Samuel's book came. But there were no teachers who formally trained me. But I think that is important. So if you feel that you want to subspecialize in something, besides your basic grounding that you get for your degree, choose a good center, a good teacher, a good mentor, and get yourself properly trained so that you are able to follow that subspecialization, because today is the day and age of subspecialization. General ENT is something that you start with, but then you get off into voice or rhinoplasty or whatever. Get yourself properly trained, have confidence in yourself, be patient. Because it takes time for things to pick up. So you can't be comparing yourself to somebody else who's in practice for 15 years and say, I'm just as good, why don't I get the same amount? Be patient to what will come. Train yourself properly, apply yourself sincerely, and success will be yours.
Mike and one would like to ask questions to Sir. Sir, for me it was one of those, it was an enthralling 45 minutes or 1 hour, I don't know, I lost
I don't know,
it.
maybe the next question is what's the menu for dinner?
But Mike, to everybody, please, whoever wants to ask.
We can have ma'am on the stage. Can we have you on the stage?
I put the mic.
So who was your favorite student and what qualities would you expect from your student?
You.
I knew you would say that, but please tell us the truth.
My favorite student, the student that I love most, unfortunately is no longer around. Dr. Samuel Merchant. Brilliant. He went on to be a professor, an associate professor at Harvard. But I'll tell you one impossible story. And this is for all the youngsters of today. I used to be a full-time teacher at KEM. For 12 years I was there as a full-time before I shifted into practice. And I don't remember going home any day at 4 o'clock and 5 o'clock. It always used to be 7:30, 8 o'clock, 8:30. And one day we were sitting down and discussing, and I said, Samuel, you know what, we keep on operating on large central perforations, and I do find that they have a little sensory neural element. So we call it unsafe and safe otitis media. How safe is really a chronic otitis media with a central perforation? I said, what we should do is, take patients with unilateral perforations and unilateral cholesteatomas, so that the other ear is there for you as a control, and see whether the bone conduction on the two sides, in cholesteatoma cases and in central perforation cases, is different. This must have been about 4:30, 5 o'clock in the evening. Next morning, when I came to the department, he put a manuscript of a paper in front of me. He said, sir, we had a beautiful recording system at KEM at that time. We had pro formas for all our patients. So he went through all those pro formas. In the evening, he got X number of patients with central perforation unilateral cholesteatomas. Their audiograms were there. He computed them. Then he went to the library. Library used to be open till 11 o'clock at night. He took out references. Then he sat and analyzed the data at night. And by next morning, he gave me a ready-made paper, which was then published overnight, after I had just put an idea into his head. That was the capacity of this man. And he went on 1 year's trip to Boston to work with Dr. Shuknek, who put him in that laboratory, the temporal bone laboratory. And Shuknek was very impressed with him. After 1 year, he came back to KEM to continue his registrar's post. And he got a letter from Shuknek in which, inverted commas, he had written, "I will make you an offer you cannot refuse." You know, it's like those gangster movies. He says, "You come back, you work in the laboratory, and I give you residency in Boston." He went back, was working there, and when Shuknek retired, Saumil was the 4th year resident in the department in Massachusetts here. And to replace Shuknek, there were 40 applicants, some very senior people. And after interviewing all of them, this 4th year resident was selected as a person to replace Dr. Shuknek. So I think, hats off to that man. Unfortunately, at a very young age, he had a myocardial and he passed away. But Sujata, you're still my favorite student. Yeah.
Sir, we all know that you are so busy as a practitioner, and you are a celebrity doctor also. So, how do you manage VVIP patients? Because we all know that most of the VVIP patients, celebrities come to you. You already have a huge running OPD of normal patients, and these VVIP patients don't have to wait. So how do you manage them actually?
Nowadays, I've come to be brutally honest with them, and I just tell them, "Boss, there is no appointment available. You want to come a little late. Thoda sa baithna padega. I'll see you, but be prepared to wait a little bit." And almost none of them complain. Almost none of them. But I think you just be upfront with them and say, "Ki nahi hai possible." I mean, if you wait, you get stressed. If I have to see you out of turn, I get stressed. Rather, you get stressed than I get stressed.
And see, Rajiv, Professor Madhavya told me 2-3 things. He also had this kind of practice. One he told me was all these without appointment patients and VIP patients, never call them in the end of your day. They will spend a lot of time because they have all the time in the world for their illness. So call them in your busy hour. And he said, whoever comes, I quote him, whoever comes, call them after 3 patients. Because that 15-minute waiting will make the job easy for you if he's going to come to you for surgery, things like that. Waiting is important. And he said one more thing. You are a surgeon. Every human being likes to get operated by an authoritative surgeon. You will always put your child to a school where the teacher is so strict that if you come 2 minutes late, she will throw the child out of the school. You will go back. He said, as a surgeon, you have to have a body language different from a psychiatrist or a pediatrician. It's called by Madhavya. And generally, VIPs are not the problem.
Their relatives.
The fellows who come with them.
Yeah.
VIPs are all wealthy. That's why they become VIPs.
Sir, I want to ask one question. Sir, what is the secret of your charm? Because you keep everyone around you charmed, and there is so much field of energy that everyone wants to do their best or give their best. So what is the secret of that?
What he had told me was, Deepak, it's in my name, Kirtane. My ancestors were all good at it and it has come genetically. But again, Guru hai, if he's going to add something to that.
Nothing to add. Okay. बाद में मिलना जब.
Sir, you are a role model for both students and teachers. Have you documented your biography and are you planning to come out with a...
Absolutely not. Biography, no. But I have had my role models. Many of you may not even be knowing them. But we also looked up to a lot of people. We tried to emulate them. How many of you have heard of Dr. Yogendra Mehra?
My teacher.
Yeah. He was in Chandigarh. He was a really big role model for me. Dr. Santosh Katkar in Delhi, Dr. Mahadevia, Dr. Ramalingam, Dr. PG, Dr. Kailash Rai in Jaipur, for example. I mean, there were so many of them. Subhash Mishra, who was in Lucknow. Dr. S.D. Mukhopadhyay, who was from Kolkata. I mean, anybody from here remember him? These are names you've not heard of, but these were people who built the AOI. S.D. Mukhopadhyay was the editor of the journal for 6 years. So these were people that we looked at, people who contributed tremendously to the specialty. And I just mentioned a few names, there were many more. But these were people from whom we drew inspiration.
Sir, thanks a lot for giving me the opportunity
So
to talk with you. You can ask more questions can follow. I'll just finish my part of the brochure. Then this will continue. We're not stopping that, please. It is just that I should not forget this. Number one, sir gave me the first opportunity this year, in his 80th year, to talk with him. Thanks to McLeod's for facilitating this. And thanks to all of you for bearing with me and my comments in between and my circus vocalist voice. Thank you so much. And sir, you made my day. Thank you, sir.
I have been with sir for many years. Thank you very much for teaching, being a very great guide and mentor. I am always awe with your surgery, sir, because whenever you do the surgery, I said, yeah, it's so simple. I can also do. But when we try to attempt it, we know what we are going through. So I want to know what makes this, how can you maintain the outcomes and consistency of your surgery for so many decades? What makes you do it?
First of all, I would like to contradict what you said. That when you try to do the surgery, actually now when I watch you do a cochlear implant, I feel that you are doing it more smoother and better than what I do myself. You should just watch your surgical hand. It's amazing. So what you said about younger surgeons doing it, here is a classic example. And no, I think, as I said, if you enjoy what you do, you want to give your best, irrespective of who the patient is. Because, as you know, we do so many surgeries at Hinduja which are done completely free of, as a matter of fact, we raise the funds for them and no surgeon's charges are applied. All these years it's been going on. But even those patients get the same amount of care and attention that a person from the first class of the deluxe room is getting. So I think that what keeps the level of your surgery going. Try to do your best.
Hi sir, Sunita. I don't have any question for you, but I would like to say some few things about you, which you may not be knowing also.
Good or bad?
Good, all good, all good, nothing bad. I came to KM as a UT. In my third MBBS, we got the unit. I couldn't get your unit. I was in the other unit. But whenever you had those evening classes at KM, the case presentation, we would always sneak in at the back. Let us listen to sir. That was my first, when I met you. Then MBBS got over. For PG, I wanted opthal, I didn't get. I wanted skin, I didn't get it. I got ENT. So when they were giving, are you okay with ENT? My first impression was looking at sir sitting in that ENT OPD of KM hospital and all the students surrounding him and sir in a typical headlight and all. And when the seat was offered, I said yes because I thought about you at that time. So thank you for being in my life. And then whenever I had any issues, I used to come to Hinduja and sir was always helpful. I started my ENT practice at the government hospital and I saw a huge difference it was making to people's life. And I asked sir, I think we should do something in allergy. What do you think? Can I start my clinic in allergy? Is it a good thing to do? Should I do it? Should I not? And this was at the journal club we used to have at Dadar and Sujata madam, we all were there.
Yeah, the journal club are very jealous because sir would get free beer for the poor. It never happened in Bangalore. Never.
Sir would not get free, but the people attending would get free beer.
No, you would get it for us. That's what I meant.
We were very happy with the journal club because obviously sir was teaching and then we would get free 5-star food or that whatever. So as a resident we were very happy for that. And because of sir I went into allergy and started the whole thing. Sir, this is a tribute to you. You are a legend, you are a teacher, you are a stalwart, you are a visionary. We all are here because of you. There are multiple things if we go on, there is no end, but thank you sir. And for me you are forever young Devanand of ENT. I gave that tribute today during the panel. This is the third time I was giving the tribute and you were not present in the audience during the talk. So I am saying that for me you are still the Devanand of ENT. Thank you sir for everything.
Good evening sir. You may be remembering I am your student. I have learned whatsoever ENT from you, sir. You have been my master, my teacher, my everything. And whenever I get chance, I used to attend your workshops, your lectures. Even in YouTube, you have something. What is very good on your part, that you understand the potential of your student. You know what your student can do the best. If he is good in ear, if he is good in diagnostics, if he is good in allergy, if he is good in endoscopic sinus surgery. Because being a student, we do not realize what we can do better in our future. But you know that this student has the potential to do this thing. And then you guide the student in that way. And that is why every student of you loves you, admire you throughout his life. Because you made the path for him.
Good evening, sir. Amidst all the questions and inquiries, I have just a request. Please write an autobiography of yours. It will help many of us, the youngsters, and later the ENTs to come. We request you, please write autobiography.
Today, I mustered the courage to do this interview. Why don't you take it up? Get hold of a good writer,
Right, sir.
help him write his autobiography.
He'll do it himself, sir. He'll do it.
No escapism. No.
Okay then, done.
You better initiate this.
Right, sir.
Get hold, see, he is busy.
Of course.
Make him write by doing 80% of the job.
Sure.
That is being a good student and being committed.
Definitely, take it.
Khel khatam, kalas.
So I would like to just share one experience as a student of yours in KEM. As you said, teaching in KEM. We have seen great teachers like you, and one incident which I cannot forget is we all as PGs wanted to do one stapedectomy before passing out. So it was like in the 5th post you get to do a stapedectomy. So we would be like, sir would tell us, okay, see this patient, yeah, this one is photosclerosis, you work up the patient. So I did that, and then on the day of the surgery, the next day the case was posted. The instruments was a problem. Sir actually got his instruments, his set for me. He stood behind me for the stapedectomy. And that is something which I was really blown over, and that is what carried me. And we were always taught that here there is somebody behind you for every surgery. When you pass out, and when you are a teacher, you are going to stand behind every student. And that is what I am sure most of your students are carrying on. And one more thing, it is thanks to Sir that I pursued neurotology. I went to his teacher friend, and that is Professor Clausen, thanks to Sir. And that has been an encouragement to go in for neurotology. So thank you, Sir, for everything. And today, Sir actually came to my clinic also, and I'm so very, very, very happy about it.
So, Sunita, you know why I was not there. I was dragged by her to her clinic. And I'll tell you one thing. I have one VNG machine, she has two in her clinic. So thank you everybody for being so patient.
Thank you, sir.